Hi everyone, I'm Dr. Mahbuba Hashemi, and today we'll be talking about intravenous nutritional therapies. So I'm a licensed naturopathic doctor in the state of California. I received my doctorate degree from Vassar University. Prior to that, I did my bioengineering at University of California, San Diego. And my practice is based on both naturopathic philosophy and functional medicine principles. My strong passions are in mind-body medicine, basically using biofeedback tools and techniques, IV therapy, which we'll be discussing, and regenerative medicine. So what is IV nutritional therapy? It's administering nutrients, in this case vitamins and minerals, directly into the bloodstream. And we'll be talking in more depth about it soon. You might be asking, well, why can't I not get my supplements or my nutrients directly from supplements? In a healthy person, if your digestive system works optimally, that is possible. But as we age, due to chronic disease and inflammation, the digestive system gets compromised. And so you're not going to get as much value through oral supplementation. And if you think about both the speed and concentration that can be delivered, intravenous therapies are much better than intramuscular, which some of us might know as doing B12 injections in the glut, and that is better than oral supplementation. And I want to put a caveat here that IV nutritional therapy by no means is to replace and or undermine the importance of good, healthy, whole diet on a regular basis for us. So definitely we don't want to skip that foundation. So where do we absorb our vitamins and minerals? Basically, mainly in the small intestine. And as you can see here in the diagram, you have a healthy intestinal lining. So the small intestine has a huge surface area. And due to inflammation, which during the summit we'll be covering in depth, you can use and you can blunt the villi, so you're going to have a villus atrophy. And the brush border cells, which are basically in charge of transport of nutrients from this side into the body, are going to get compromised, leading to leaky gut or intestinal permeability, which again leads to a whole slew of problems, and we'll be covering that during the summit. But in the context of today's discussion, what we need to know is that it leads to malabsorption. One of the advantages of IV therapy, like we said, is that it bypasses the intestines. So the process of digestion, absorption, and assimilation is taken out, and the nutrients are directly through the bloodstream are delivered to the cells. And because of that, you can take up much more of them. So, if you think about, let's say, one of the important vitamins, vitamin C, you have, on average, during a single day, you can take about 2.5 grams before having GI problems, intestinal reaction. But you can go up to 100 grams in a high dose vitamin C IV, which we'll talk about shortly. And again, this is great for people who have digestion and absorption problems, and these can be because of either low stomach acids, deficient digestive enzymes, intestinal permeability, inflammatory bowel disease, food allergies, and just resulting in nutritional deficiencies. So what can we treat with IV therapy? Fatigue, so either be it because of adrenal dysfunction or thyroid issues, both hypo and hyper, immune system dysfunction, addressing both chronic infections as well as acute ones, pain, so migraine, headaches, cardiovascular disease, consequences or complications of diabetes, so in this case, peripheral neuropathy, liver disease, cancer, and just maintaining wellness, general wellness. So some of you might have heard about Myers cocktail. It originated by Dr. John Myers, who was a physician in Baltimore. And he used it originally to address migraine headaches and asthma. But he began to apply it to other conditions such as chronic fatigue, fibromyalgia, and respiratory illnesses with great success. And if you ask, well, what would it do for me? It can improve your energy and reduce your fatigue. It can help with your sleep as well as cognition, so allowing your brain to function better. It can help to either prevent or actually reduce the intensity and duration of acute illnesses. So let's, for example, take flu. It can address also chronic infections, which we'll talk about in several slides to come. It can reduce pain. We talked about migraine headaches and Myers cocktail, and speed up healing. So skin wounds, speeding up post-surgery recovery. What would be in a typical Myers cocktail? So we have B12, which helps with nerve conduction, energy, and metabolism. A lot of us who have received B12 injections know how we feel energetic after it. Vitamin B6, again, helps with mental and brain health, metabolism, hormone imbalances, helps to correct them. Vitamin B5, it's great for adrenal health. The adrenal, it's really essential for the synthesis of those adrenal hormones. Magnesium, which every day we hear more and more the benefits of this amazing mineral, and it's great for migraines, cardiovascular health. Calcium, similar for muscular health and heart health. And lastly, of course, vitamin C, which helps with both immune function and healing. So, and you know, that was the typical Myers cocktail, and there are modifications to that. So you can add other agents such as taurine, carnitine, and acetylcysteine, selenium, and zinc, which are all great. And for maximum beneficial effect in chronic cases, we recommend about once a week treatments for a month, and then moving into once every other week into once per month. But it's important to notice that the frequency really matters. It depends on the case, and so your case and your goals will set and determine the frequency. And the typical treatments take about 45 to 90 minutes, depending on how big the IV bag is, the size of your veins, and also your tolerance. Let's talk about high dose IV vitamin C, which I'll refer to IVC from this point on. It's it uses anywhere from 15 to 100 grams. A lot of times we start on a lower dose to see how the patient will reacts, and then kind of ramp it up in the subsequent treatments. It's, you know, if you think about nowadays, most of the supplements are about a gram. So to get that much without, of course, it's going to be very difficult to tolerate that much. But if we were to reach that, it would mean taking about 15 to 100 packets, tablets, or capsules of vitamin C. And we don't want to be doing that. So what does vitamin C do for us? At a low dose, and in the next slide we'll talk about high dose vitamin C, it's an antioxidant. It's been shown to reduce free radical damage, which basically antioxidants kind of scavenge for free radicals in the body and helps in collagen synthesis. And collagen is not only important for wound healing, but for healthy tissues, muscles, and ligaments, which are extremely important parts of tissues in our bodies. In the high dose cases, vitamin C can be cytotoxic, so it's toxic for the cells, and it's been shown to be helpful in treating cancer. Normally it's used in combination with other conventional cancer protocols, so chemotherapy and radiation, Also, high-dose vitamin C has been shown to be promising for treatment of chronic viruses, and because of its immune boosting ability. So hepatitis C, EBV, cytomegalovirus. For cancer and chronic viral conditions, we recommend anywhere from 1 to 3 treatments per week. And again, as we mentioned before, the length depends on the size of your vein, quantity of IVC in the bag, vitamin C in the bag, and so considering those, it's about 1 to 3 hours. And in this case, assuming we have a 60-year-old patient with 50 grams of vitamin C, which is at that starting point of high dose vitamin C, with normal vein size, it would take about an hour and a half. And on to glutathione. So glutathione is the supreme detoxifier in the body. It's extremely, extremely potent antioxidant in every single cell of our body, and it can help with reducing the risk of developing cancer. It's improved autoimmunity, such as multiple sclerosis, neurodegenerative diseases like Parkinson's, and it's liver protective. So it can either prevent or reverse liver damage because of high consumption of alcohol or hepatitis. And glutathione can be administered either as a standalone therapy, IV therapy, or alongside other IV therapies. So if you're doing Myers or high-dose vitamin C. And for chronic autoimmune conditions, again, patients are recommended to do 1 to 2 times per week. And then the way it's done is in a ramping up fashion, meaning you start at the lower dose and work your way up to larger doses. And it's depending on the dose, it's a short duration IV push, so about several minutes. And other great IV treatments are curcumin. Curcumin is a strong anti-inflammatory agent. It's used in conjunctive cancer therapy. You have alpha-lipoic acid, which is an antioxidant. It's helpful in peripheral neuropathy. It's also helpful in preventing radiation damage. Phosphatidylcholine, we have it in every single cell. A cell wall is made up of the phospholipid bilayer and phosphatidylcholine. So the structure of every cell, integrity of every cell, is dependent on having this as one of the agents there. And it's important in brain health, heart health, and just like glutathione, it's also helpful in addressing liver damage. So a couple of cases and seeing just what IV therapy can do. Joe, of course, his name has been changed, a 39-year-old male who would receive Myers cocktail before and after he would travel a lot for work and sometimes overseas, so long plane rides. And he really felt that the IVs would help both boost his immune system. So we know how it is to travel through airports, especially nationally and internationally, and sit on the plane for hours and hours. It kept him hydrated and energized. And Sarah, 47-year-old female with colon cancer, she would receive IV treatments about 3 times per week, high-dose vitamin C, between her chemotherapy treatments. And she felt that receiving these IV therapies would help her cope with chemotherapy better, recover faster, and just overall, she was feeling better. So you might be asking, well, how would I know if IV therapy is right for me? So the process is that you would meet with a doctor who's certified in doing IV therapies, to have a basic history and physical exam done, history taken and physical exam done, and do some basic labs such as CBC, CMP panels to really assess your kidney and liver function, look at your electrolyte levels, and in case you're looking to do high-dose vitamin C, to screen for that to make sure you can do it. and then after that, you will be meeting back with the doctor to go over the lab results and also to really come up with an individualized protocol that would fit your needs. So if you have any questions or need more information, please visit me at doctormahboubeh.com. It's DrMahboubeh. You can follow me on Instagram at Dr. Mahboubeh, and also Facebook at Dr. Mahboubeh. I'm pretty consistent. And I hope this presentation was helpful to you and you got some information on IV therapies. And I look forward to hearing from you.